Hi, Ms. Claire. My name is Bernadette, and I'm from year 11, and I'm also in the journalism club from FilBrit International Academy. Thank you for agreeing to this interview. I know that it's a very much busier this year for the teachers because we have a lot of new things going on, and Miss Maggie is always complaining about the work. Please don't.
But then it's my pleasure to be part of your newspaper, and also it's my pleasure to inform not just you but everyone, especially the awareness about the special topic that we have, which is send students or send. These are people, young and adult of determination. That is the other word for send children.
Okay. Miss, I'll just go over the general interview structure, the contents of this interview. So first, we'll be starting with the introduction, and then we'll set the focus and tone of the interview, and then we'll start off with the definition of SEN, the common misconceptions and misunderstanding, and what it really covers. And then third will be a little bit more personal. If you're uncomfortable or you're not really open to sharing certain things, we can skip over that. So now the third content will be experiences with SEN. So not only with the students, but with parents and fellow educators as well. And then we have the common signs of learning difficulties or differences in students and how to approach, offer help to them and their families, as well as the availability of resources and methods of support that we have. Let's keep it specific to FilBrit alone so that it's not too much to take in all at once. So we'll keep it within our own school. And then we have also the social stigmas of SEN, regarding SEN. And then the last one will be about the purpose of SEN, its importance and relevance to the modern educational systems, and what can be done, what can we do to raise awareness for it. Okay?
Yes.
So that's the general content of the interview. So let's start. Miss, would you like to introduce yourself first?
Okay, I'm Claire, or people call me Miss Claire or Teacher Claire, most especially my students, and I'm a psychology major, and also I'm a licensed teacher, especially in the Philippines. I'm one of the teachers here in FilBrit Training Center. Actually, I'm the first teacher and staff of FilBrit Training Center. I joined FilBrit like in 2016. So on July of this year, that will be the 8th-year anniversary of FilBrit. At the same time, that will be my 8th year in the company. I'm handling children, all types of children, most especially foundation stages, like from 3 years old until 7 years old. Those are my forte. And also, I'm handling students, like children under special needs. So I have students like early years, like at the age of 4. So once they have the clinical diagnosis or they don't have it, as long as they need some training, I'm not working as a therapist. Although in the Philippines, I used to work as a behavioral therapist for autism children. But here, I need to be licensed first before I can be called like therapy. So since I know the process, I know the strategies. That's the one that I'm doing with my students so that I can also help their parents to save money, because having a therapist is a huge financial obligations. Although I'm still recommending or telling to the parents that they also need to consult specialists like speech or occupational therapists. But then for the behavioral, I can help them. So basically, those are the things that I'm doing. Also, I'm teaching regular kids, just like you.
The students will be very excited to learn new things about you, Miss, because I don't think they're very familiar. They're not familiar with this, no? Some of your students. Okay,
Yeah.
about your background, so really excited. Okay, so let's start off with the definition. So I know that I've said in the beginning that special education is a very broad and very deep topic. So for this interview, let's just focus on the general overview of the matter. So we can think of this interview as a way to raise awareness to SEN and clear up some questions that ordinary people may have. So that's rather than an in-depth talk, let's think of it as a way to raise awareness instead. But we'll aim to discuss as much of it as possible. So, according to the web definition of SEN, special education is the practice of educating students in a way that addresses and accommodates their individual differences, disabilities, and specific needs. So while I was brushing up on this, Miss, like prior to our interview, I read that there is a difference between special education and individual education. So what can we say about that?
Okay, for SEND, as we all know that SEND stands for Special Education and Needs. Before, they only call it SEN. It's like as long as there will be a special needs for any individual, and also they have a clinical diagnosis, then they will be under this category. Then later on, they discover and they notice that not everyone understand have special needs, but instead they are also having, or some have a disability or difficulties. It means they're having difficulties to learn specific skills like the other kids of their same age. Like for example, reading. Like for other kids, for regular kids, they can learn how to read only for a month. But then for other children, they will also learn how to read, but it will takes longer time. See?
Mm.
So first, that is the definition for SEND. And they can only be called as SEND as long as they have clinical diagnosis. As long as they don't have it, they cannot, or we cannot identify specific children or specific child to be under this category. And then next, what's your second question? Sorry.
That there is a difference between uh,
Individual.
special education and then individual needs. So what is the difference between the two?
Actually, the individual education, it's more on that is the strategies. How are you going to address or how are you going to help the students? Because basically, if you're going to say or identify special education, it is already um, identifying also the individual needs, the individual education of the learner. Like for example, if you have a special or if you'll be under special education, then it means you have a different lesson plan. It will be categorized as individual educational or IEP, individual educational plan.
Okay. Oh yeah, I've seen that as well.
Yes.
And
So it
yes.
means that is the approach that the student will have or will get once they are under special education.
Okay.
Like for example, if the student has a difficulty socializing and communication and communicating, so it means their individual education should be focusing, or the IEP should be focusing to the communication and socialization part. Then academics will
Okay.
follow.
Oh yeah, that would be more beneficial to the students as well.
Yes, it's like you're going to have an individualized lesson plan instead of a lesson plan in general for everybody.
Yeah. So it's like a one size rather than one size fits all. This one is more tailored to
Yes.
individual person. Okay. So, Miss, what are some, if you're willing to share, what are some common misconceptions and misunderstandings that ordinary people usually have about such programs when they hear it, maybe from a friend or maybe just in passing?
Oh, I have a lot of encounter with misconception or stigma once they hear the word SEN or my student will be categorized as SEND. First, the misconception is they categorize SEND or learning disability as mental illness. It's two different things. Learning disability or SEND students. So once you have a learning difficulties, you can be under SEND. Then once you have that, it doesn't mean that you are sick. Okay, the misconception about SEND and learning disabilities is not an illness. Okay, not unless you have a health complications. But if it will be learning disabilities alone, then it's not an illness. There's nothing to cure. That's why they don't need medicine. Although it's a lifetime condition. So once they will be diagnosed with a learning disability during childhood, then it will last until adulthood. It's not an illness. There's nothing to cure. They don't need medicine. However, they are trainable. Those students understand they are all trainable. All things like socializations or social skills and also behavioral, they can be trained and they can be learned. Another misconception is sometimes they will thought like children under special needs or students that have learning difficulties are
Mhm.
already slow learners, or
Yes.
sometimes they will thought it that they have a less intelligence, but that's not true. The only thing why, or the only reason why they are under special needs or they have a learning disabilities is because their brain was
Works
developed in a
differently.
different way. Like
Yes.
the part of their brain, or the part of their brain that works with letters, that's the only one that is not fully developed. Or maybe the part of our brain that deals about numbers, that's the one is not fully developed. That's why some students or some individual, they are failing maths, or they are having difficulty reading because they are dyslexic, or some parts of their brain what was not developed, like socializing, that deals with social
Mhm.
communicating. But they might have difficulty, but it doesn't mean that they are already, or that they have low intelligence. That's
Yes.
the misconception. I encounter a lot of that. That's why other parents doesn't want their children to be called understand, because they thought it's an illness. They thought that
Yes.
it's a type of a disease. They thought that they will be categorized as slow learners or poor
Mm.
IQ, but they didn't realize that sometimes the child having a special needs or under learning disabilities, they are the most intelligent or the most creative student that we're going to
Yes.
capture.
It reminds me of I wonder if you've seen this, but it's in YouTube where there was a young man. He's not even past 25. He was under a SEND program, special educational needs, and he what do you call this? He absorbed information like 5 times slower than the average person, but thanks to such programs, he was able to become a professor at a very prestigious university.
Yes, and are you familiar with the series The Good Doctor?
Yes.
Yes, that is one example of special education needs or
Mm,
other learning difficulties.
yes. Okay. So to summarize what you've said, Miss, it's not that there is anything wrong with them, that there's anything to fix, that they're not broken in any way. It's just that with the way the world works now, you know, like people who think differently or who act differently are treated as anomalies, instead of accepting it as natural in a
Yes.
way.
Actually, um it's like you are playing, or you have what do you call this? A PlayStation,
Mm-hmm.
an Xbox. They are both a gadget. However, most of the time, the what do you call this? The game for your PlayStation is not applicable for the Xbox.
Yes,
But it
yes,
doesn't mean that your gadget is broken already.
yes.
That you need to have the right materials or the right game or disc so that it will going to work properly, just like with our students or just like us. We need a special learning, or we have a special learning styles, and that's what we need to find out how we can learn more. And those are the strategies that we can also use to other students who are having difficulties. We just need to find out what are the strengths and
Mm,
how they can learn those informations in the right way.
yeah, in a way that's effective for them.
Yes, in a way
Yes.
that your brain can understand those informations. Because once we find out, and once we do it, the correct strategies, then they will learn more.
Okay. So Miss, you've been a teacher, well, only in FilBrit for about 8 years. Yes, that's a pretty long time already. So you've had also teaching experiences in the past before you came to FilBrit. So it's a long time already. So if you're comfortable with sharing, Miss, over the span of your career, what were some of the most memorable experiences you've had in regards to special education needs, this type of program?
The SEND program, I have a lot since I started after college. I was
Um,
a behavioral therapist for autism in Makati. Then the most memorable experiences will be the hard one. Real
yes.
difficult ones also because, like for example, I had a students way back then that they are going to bite me, they're going to hit me. There will be a lot of hitting. What do you call this? Um, physical
Yes.
hitting. But then the pleasurable feeling, it's not the hitting part, not the biting part, but when they stop hitting or when they stop hurting me.
Mm,
And here in FilBrit, I also encounter most of my students. At first, the tantrums, the screaming
mm,
will take like 30 to 40 minutes. Then
uh,
once they learn how to manage their tantrums and how to stop those violence or hitting or hurting behavior, then that will be the most memorable experiences.
yeah. Miss, I just wanted to insert that I've read somewhere that people who have learning disabilities or how when their brain works differently, that they see the world very differently than us. Like some of their senses are heightened. Like it's not as everyone else. That's why they react in these ways that are unexpected and difficult for us to comprehend. No.
That's why we need to what we call this, we need to stop thinking that we need to cure them,
Mm,
but what we need to do is to understand them,
understand.
how they
Yes.
see the world, how they see things around them, and how it will going to help them.
Mm. Okay. So, Miss, other based again on your experiences, was there ever a time where you've encountered like difficulties with maybe the parents or the another fellow educator? If you're comfortable with sharing this.
That's why for the parents, I think that the most difficult part is when their children are undiagnosed.
Mm,
Like I cannot the proper way of telling them that there is something that their child needs in a different way is not by telling them upfront that your child is under autism or your child is a dyslexic,
mm,
but we need to help them realize that their child needs more help. So the most difficult part is the denial part. They
yes.
already know, they already know that their children needs help, that they need to consult specialists, that they need to have diagnosis, but they are trying to deny it. Like they're going to justify those behaviors, those actions. Like the most common one, it's they are only child, they don't have anyone to play with, that's
Mm,
why they don't know how to react or how to talk or how to communicate. And sometimes they will tell me like, teacher, he's quiet because he's shy. So what I'm going to do is just convince them that there are different developmental stages for every children, for every one of us. And once there will be some red flags, then they need to consult specialist.
mm,
Fortunately, they listen, but it takes time. They will
mm,
listen and ask for some recommendations. Then I'm going to just to let them know or just to inform them that they need to consult specialists. Then once they have the clinical diagnosis, then I'll be here. Whether they have clinical or they don't have clinical diagnosis, I'm going to do my part to help their children.
mm. Because Miss, right, that as a parent, it's also hard to
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 accept.
to yeah, if we put ourselves in their shoes, most likely than not, we'll also react in the same way that we don't want to. It's also part of the love and the care they feel for their children. They don't want to, bring them down in any way, make them feel as if there's something about them that is not good. So yeah, I understand
Actually,
about that.
I think they are more on scared about the
Yes,
condition.
yes, yes,
They're
because
not
they are
worried
aware.
about the condition, but they are worried about the environment itself,
Yes,
the
yes.
society. Because of course, who wants to be discriminated? No one, right? No one. Even I myself, I experienced discrimination when I was younger because I grew up in California, but not in a Filipino community.
Mhm.
Don't have friends because I'm Asian. I'm the only Asian in our community. So no one wants to be discriminated, especially if we have a learning disability, or especially if people will know that the child is understand, because not everyone are aware of it.
And the biggest fear is fear of the unknown.
Yes,
Humans tend to react badly whenever we're faced with something we don't understand.
yes,
So it's
exactly.
understandable. So that's important really to talk about things like this. Okay. So Miss, let's talk about eligibility. So how do schools identify individuals who would benefit from these programs? Like I read that there's a sort of comprehensive evaluation that is involved to test whether a person is okay for this program.
There are different tests. There are different tests that schools, especially SEND coordinators or those specialized with behavioral and other learning disabilities, there are different what do you call this assessment that they can have.
Mm,
So the eligibility, I think everyone is eligible for that as long as you are well informed, you are equipped, knowledgeable, equipped. And then schools, they also need to consult specialists. For other traditional schools, big schools, they have send department. They have complete staff from the send coordinator to the learning support. And sometimes they have outsourced contacts for different therapies.
oh, okay. So on that note, Miss, in terms of FilBrit, what are some methods that we are applying to our school system to help students with specific learning differences? Like what resources are being provided, not only to the students, but also the parents, the teachers, like maybe facilities, like orientations, things like that.
Okay, first, we have open communication for parents and students, especially for parents if they suspect or they are already aware that
Mhm.
their students or their child has a learning disability or difficulties, they can come to us and talk about it. And for others, once they informed us that their child is having difficulties, we're going to have assessment. Usually, I run the assessment. Then for the final assessment, it will be Dr. Mark Evans, our chairman. And then once it will be um, proven, like they are really having difficulties, whether they are clinically diagnosed or diagnosed, it's much better if they are clinically diagnosed, because we can identify and put them, or we can have the proper early interventions for every student. Since it's British curriculum, we design the individualized project list for them.
Um,
Like just the one that I mentioned, although I have here 8 students, then as long as I already identify what are the weaknesses and strengths of them or the students, I'm going to design their project list according to their needs. So that will be the individualized educational plan for them. Like there's a need for me to start the early foundation, although they're already year 7. Then if there's a need for me, then I'm going to do that.
okay. What about in terms of the teachers, Miss? Like, other than Philbert, you've had experience outside as well. So, what about like conferences, like specific training? Because although that programs like SEN exists, like to help students, there are also schools that probably don't have or can't afford to invest in these programs. So, what has been done to help teachers to deal with certain situations like this?
For FilBrit, like for us, we have a short course or a workshop
Mm,
every month. I am teaching teachers, assistant teachers, any adults, especially if they want to work in school as a learning support. I'm teaching them how to be a shadow teacher. A shadow teacher, that is the legal term before that KHDA is using. But then now they change it because shadow teaching, there is somehow a negativity attached to it. So they change it into learning support assistant. So I
okay.
am doing trainings, workshops every month for individuals, including our own staff, our own teachers. We're giving trainings for them. And then we have different levels of workshops like level one, we're teaching different strategies, how to handle teaching strategies, how to handle different learning disabilities like autism, ADHD, dyslexic, dyscalculic, and other things. Level two, we're going to teach them and help them how to design and understand IEP. And then level three, we're going to, it's like a research, it's like a thesis. They're going to do an actual research with one specific student. So if they don't have any, or if they don't know anyone to run the research, then they can stay on my class and they will work like OJTs.
Uh, okay, Miss, because the reason why I think that this is very important as well because for those schools that don't have SEN programs, right? They have no choice. Even if they wanted to, they have to put the the child in the general
Yeah.
classroom, right? So
And usually I encounter schools, they are the one paying for the tuition fees for those participants who will attend our workshop for shadow teaching.
mm,
They're sending their learning support itself if they don't have certificates and any other
mm,
experiences. And also they are sending like teacher, assistant, or even their teachers so that they will learn more, understand more, and of course have the certificate.
okay. Thank you, Miss. So now we're moving on to the purpose of SEN, its importance and relevance to our modern educational systems. So let's see. So we've talked about some of the common misconceptions about special education. So how do you think, Miss, these misunderstandings influence our culture and our society at present? Like how the social stigmas on SEN affect the way we live and the way we learn?
In a negative side, I think if there will be less informations about send, then we're going to still have the stigma about negativity about it. But fortunately, nowadays, especially there are a lot of awareness like autism awareness, Down syndrome awareness, and other things. We are now starting to open our minds and accept everyone. And one good thing, especially for about UAE, about
Yes.
schools, is we are practicing inclusion. It means anyone can be enrolled and be accepted in any schools, including FilBrit International Academy. So it's more about inclusion now that we have a lot of informations and a lot of awareness. We're starting to remove the stereotype when they
Yes.
we see when we see a child having different behavior, we're going to tease or we're going to ignore. But now we are we are helping and reaching out to those children.
Yeah. And I think that technology really helps with spreading the word, no, especially social media. Everyone has a phone more or less
Yeah,
around the world, so
different platforms.
information travels very fast, which helps the development, no, and the progress that we're
And
making in this
also, I
field.
think that the movies, not just the social media, but also the different movies that we have. Like, for example, although it's an old movie, have you watched or heard Every Child is Special? You can
Mhm.
find it in Netflix. It's an Indian movie, but there is a subtitle like English, wherein the child is having dyslexia, and that is the very good.
Hang on, Miss, is it
I
like
really love that. I recommend that movie.
the she had like an art teacher or something that he
Yes,
was able to express
yes, he's the
his
most
talent with
creative
art,
student
no?
when it comes to art.
Yeah, oh yeah, I
Although,
watched that movie.
yeah, though he's at first the family thought that he is having behavioral problem, and they thought that he has a low IQ because he has difficulty reading. He cannot concentrate. But then the teacher find out that he is dyslexic, but nobody knows or nobody understand what is dyslexia.
Especially the father did not want to
Especially the
accept.
mom and the dad, right?
Yes, yes. They
And
always compared him, I think, with his older brother who was
with
like
other
top of
kids,
the class and
that
stuff.
is the best example about sand, about the what they call this, the picture about sand. Because sometimes our family doesn't understand the way we learn. Sometimes they will categorize like, do you understand Tagalog? Like for example,
Yes, yes.
kid or bobo, but
Mm,
there is no unsmart kid. Everyone is a genius at something. It's just that they are waiting for other people
for
to,
someone to draw it out,
yes,
to
to bring,
help them show it. Mm.
try to motivate other individuals like your friends, your families, your relatives to watch that movie. It's really a good movie.
Yeah, Miss. Yeah, I watched it when I was younger, so it was very nice. I love. Like maybe at that age, I couldn't really understand the significance, but I understood that it was something important, and it was a very nice movie. I think I'll watch it again sometime again. Okay, so now we'll be moving on to the last section of our interview, which is yeah. Okay. So, as a teacher, Miss, what are your ideas on how we can raise awareness about this topic? Like, what can we do to help people, or especially those around us, first and foremost, to be more open minded and gain a better understanding of the subject?
First, educate each and everyone, whether young and adults, like what I am doing in some of my group activities every year or every term. I am allowing or I am asking parents, since I'm handling little ones, so I'm asking their parents or their guardians to sit one of our group activities so that I can give them like just a short training what is sent, so that they will not be shocked or afraid
Mm,
or worried whenever they see some students in our classes like they are already big kids just like you, so that they will understand more that these children are just like their children who likes to play, who likes to learn, who likes to do arts,
yes.
who likes to sing and dance. So basically they're just regular kids just like anyone else. It's just that they need help. They need help for other parts of their or other skills, other areas. So just
Okay.
educate everyone,
Mm,
because with
yeah.
education, proper information, then we can make this world a better place for each and every one of
Yeah.
us.
Especially in the age of information and technology, this this should be more uh, talked about, But
Yeah,
the world has a way of what do you call this? Talking about something less important things, more entertainment. So this very good. We should have more opportunities to
yeah.
really show and talk about this. So, Miss, I think that is also we've covered as much as we could. Maybe in the future we can talk more in depth So we just talked about the general, some aspects of it. But when I was doing research on this topic, okay, one video only, it didn't last. I only watched one video, but I read a bunch of papers, and that one video already packed so much. And it didn't even pass more than 11 minutes. So it was
I
really a lot. So
suggest, I suggest since sand is a broad topic, then we can
mhm,
talk one difficulties or one area of difficulties per training, or if you want to learn more, just learn one at a time. Like each and everyone will have, or it will be categorized as a general, like learning disability or special needs and special education needs and disabilities. But what we need to do is just choose one topic, then learn about it so
yes.
that we can understand it more.
Mm. Because when I was looking through it, like I know some ideas and aspects of special education, but only when watching that video that I really realized how shallow, you know. And I'm thinking while watching it, I'm like, what about other people who know little to nothing about this topic? I wish they could see this. Like, even just that one video is enough to really more open one's mind more about things like this. So I really hope this. So this in the future, if you're available now, we can have more interviews like this again, like you said, to speak about some more specific topics in depth.
Yes,
Okay.
I'm looking forward to it. So maybe we can start like autism or
Mhm.
dyslexia.
Yes,
So any topics. Just let me know so that I can share some of my knowledge about it. So that next time is not everyone will be ready how to handle
yes,
or how to talk to these children.
yes. So to conclude, Miss, is there anything you would like to add as your closing remarks for this interview?
Actually, none. It's just my pleasure, especially talking to you, so that I can give
Yes,
information. Although we only have like a limited time, but I'm sure soon we're going to talk more, and
yes,
maybe
for
we
sure, Miss.
we can start with your small group, like group of friends or group of your classmates.
Okay, Miss. So I think that's all for now. Thank you so much, Miss, for this time. I know it's very busy, very, very busy for all of us. Also, Miss Janet. So thank you for your time, Miss, and hopefully we can talk again and schedule another interview.
Yes.
Thank you.